Hello, everyone. I am Dr. Raina Shaikh from Asher Clinic, and I have been practicing homeopathy for last 25 years. And I have involved this practice of GNM along with homeopathy for quite some years now, and it is giving me excellent results. So today we will be discussing a bit of GNM in this lecture. Let me share the screen. So I welcome you all to the 8th anniversary celebration of the Global GHK. The information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical services. Participants should consult their medical doctors for health reasons before using anything that is disclosed during this course of presentation. Students shall not use any of the different information given in this presentation while writing their examinations. So I start with paying my gratitude to Dr. Hahnemann, father of homeopathy, and Dr. Hammer, father of GNM, who have been showing light to me in my 25 years of practice. My topic for today is diabetes mellitus. So it is a very vast topic, but we will be discussing a small portion of it with the help of a case. So as we all know, diabetes is a chronic metabolic disorder which is characterized by elevated levels of blood glucose, and it leads or if it affects many organs in the body like heart, blood vessels, kidneys, eyes, the nerves, etc. It is often referred to as a lifestyle disease because the onset of diabetes, or when we come to know the symptoms, it is mainly influenced by our day-to-day habits in our lives. Especially the type 2 diabetes, particularly, is closely linked to factors such as diet, physical activity, stress, sleep patterns, adopting a healthier lifestyle, such as eating a balanced diet, exercising regularly, less junk food, as of now, sleeping patterns, sleeping early, waking up early, and going for exercises can prevent or helps us in managing the disease. But what about the root cause? See, here we are going to throw light on the lifestyle changes with the help of our knowledge from the Germanic New Medicine. So as we know, pancreas is an organ which is mainly concerned with the control of sugar in the blood, and it is the reason when this control is lost, the blood sugar level increases and we term it as diabetes. It has a dual role, means it has an exocrine as well as endocrine function. The exocrine pancreas produces enzymes and pancreatic juice which help in digestion of the food, whereas the endocrine pancreas, which make the hormone insulin and glucagon, which help us to control the blood sugar level. That is the hormonal function. So since we are studying diabetes today, we will concentrate on the endocrine pancreas. Any damage to the endocrine pancreas and dysregulation of endocrine secretion may lead to impaired glucose homeostasis and cause the dis-ease, which in the modern medicine we term as diabetes. So what is the pathophysiology? In diabetes, we have the type 1 and the type 2. So in the normal process of type 1 diabetes, the beta cells of the pancreas produce, store, and release insulin. This is a normal process. It produces, it stores, and it releases insulin when the blood sugar level rises. Whereas when there is a little imbalance that happens because it is an autoimmune disorder, means the T cells destroy the beta cells within the pancreas, as a result of which the amount of insulin secreted in the blood decreases, and that leads to increased sugar level, which we term as type 1 diabetes. What is type 2 now? So on the cells of our body, we have insulin receptors. So when the beta cell produce and release insulin, this insulin is accepted by the insulin receptor so that it can carry the glucose from the blood into the cell to give it energy. So when the insulin receptors are fired or when they become resistant to insulin, the amount of insulin released in the blood is normal, but the amount of glucose carried by the insulin through the receptors into the cells is reduced. As a result of which, what happens is when the cell receives less glucose, the message sent to pancreas is we need more insulin to transfer the glucose from the blood to the cells, as a result of which there is hyperfunction of the beta cells. And since the function is accelerated, there will be damaged. The beta cells will be damaged. There will be damage in the pancreas, as a result of which the insulin level goes down. So the insulin resistance and inadequate insulin leads to type 2 diabetes, which leads to increase in the glucose levels of the blood. Now, the symptoms which with people normally which are associated with diabetes are polydipsia, polyphagia, and polyuria. That is increased thirst, increased appetite, and increased uh, uh, frequency of urination. Also, there will be weight loss. On blood test, you will get high blood sugar level. There will be lethargy and weakness. And of course, the wounds don't heal easily, and many more. Complications of diabetes usually affect the organs such as eyes, leading to retinopathy and blindness. Then the cerebrovascular disease, it will affect the heart. It will lead to permanent damage of the kidney, also can lead to diabetic foot or ulcer, and there will be damage of the nerves. So how does GHK or the German New Medicine throw light on diabetes? We will study about that now. So now here we know that since we are studying diabetes, we'll talk about the islet cells of pancreas. They are formed from ectoderm and they are governed by the diencephalon part of the brain. So embedded in the pancreas glands are clusters of the islets of Langerhans that play a significant role in regulating blood sugar. You have the alpha islets which secrete glucagon, a hormone that stimulates the liver to convert glycogen to glucose. So when the alpha cells are activated, you have increase in the increase of glucose in the blood, increase blood sugar in the blood, and when insulin, which are produced by the beta islet cells, which help to convert the blood sugar into energy and it is deposited in the cells. So when the insulin increases, the level of sugar in the blood goes down. So the alpha and the beta islet cells originate from ectoderm and are controlled by the diencephalon. So here you will see this part, this red part. The left side is called as the glucagon center. That is the alpha islet cells are present there. The control of the alpha islet cell is over there. And the right side is the insulin center. Again, the same thing and put up in words. The alpha and the beta islet cell belong to group of organs that respond to the related conflict, not with cell proliferation or cell loss, as we see in the other organs controlled by different other part of the brain. But during the conflict activity, you have either a hyperfunction or functional loss. That is what we see in case of islet cells. So when there is if we consider the alpha cells during the biological conflict linked to alpha cell, you have the female fear disgust conflict, or in male, we have the, depending upon the person's gender laterality and hormone, you have the male resistance conflict. So what is female disgust conflict? A female fear disgust conflict. So it is a fright coupled with disgust regarding a situation or a person. The conflict can be brought on, for example, by revolting sexual experiences, sexual abuse, unwanted sexual practices, violent sex, or distress involving blood, feces, urine, anything which comes in contact and you feel yuck, being frightened by a person, a drunkard who is around in the family can provoke this. Even the smell of alcohol, which you don't like, can provoke a fear disgust conflict. What is a resistance conflict? Now, resistance conflict is like, for example, you are swimming against the current, where you need excess of energy. The resistant conflict is a strong opposition against a person, against a situation at work, home, at school, in a relationship, against an institution, against any decisions which are made, and there is a resistance from the home people or at their workplace, or you are forced to do something against your will. We have a rubric in homeopathic, a very good one, undertaking things opposite to intentions. So, this matches with this resistance conflict. Children suffer the conflict at an early age when they are put into the daycare. They don't want to go, they want to be with the family, but then they are put there, or anything, even in the adolescence, when they are opposed to doing certain things, it will lead to the resistance conflict. Now, what happens is the function of alpha cells is reduced. What is it? In this case, there is hypofunction. So, as a result of which, there is decrease in the level of glucagon production. So, what does glucagon do? Glucagon increases the level of sugar, decreases the level, it increases the level of sugar in the blood by converting by gluconeogenesis. So there will be hypoglycemia. The symptoms seen will be nausea, dizziness, fainting, trembling. Because of the less glucose in the cells, there will be muscle twitching, which can also include the heart muscles. So hypoglycemia automatically will lead to craving for sugar. So there will be too much craving for sugar, which serves the purpose of balancing the blood sugar level. The steady overeating, which will lead to weight gain and obesity. But because of this regular craving for sugar and regular intake of sugar, the hypoglycemia goes unnoticed. You will not come to know that there is some problem or there is some conflict which has affected your alpha cells. Now, in the healing phase, we have PCLA and the PCLB. So, during the first part of the healing phase, that is in PCLA, the glucose level slowly rises to the normal level. But during the epileptoid crisis, when the conflict activity symptoms are reactivated, the blood sugar drops temporarily, and that is the acute hypoglycemia. In the PCLB, the blood sugar level increases above the normal range. Means because of the hypoglycemia, acute hypoglycemia, now it will increase above the normal range, showing the symptoms of diabetes, and then it will come back to normal. So there is healing. But in case if there is hanging healing, means the conflict is relapsing again and again, in this case, the insulin is produced but is not utilized for carrying glucose to the body cells. And this is the insulin resistance, which we call as the type 2 diabetes, also referred to as adult onset diabetes. Okay. Now, in the beta cells conflict, again in males, we have the resistance. In female, we have the fear discussed, depending on person's gender, laterality, and the hormonal status. So what happens in conflict active state is, here there is the function of the beta islet cells is reduced. And because the function of the beta cells is reduced, there will be less insulin secretion, and as a result of which there will be high blood sugar, and that will be termed as diabetes. The biological purpose of storing glucose in the blood is to prepare the individual for conflict resolution by providing the organism, particularly the muscles, with a sufficient amount of blood sugar in order to be able to fight with full force. The degree of hyperglycemia, how much fuel will be available, is determined by the intensity of the conflict. Means the person is swimming against the current and he is needing energy. So the body is trying to store or have more glucose in the blood so that whenever it is needed, he can take up the glucose and be energetic and fight with full force. For additional support, now if the person is in the crisis, the liver also secretes glucose, a process called as gluconeogenesis. Biologically speaking, the active fight, the response of standing up and to breast means in the male, especially in the male, response is what? Resistance conflict. So what he will do is he will stand up strong. Okay. And whereas in female, it will be fear disgust. So in female, usually you will have the, when there is a fear disgust conflict, there are fainting spells. Typical for diabetes is extreme thirst for which serves the purpose of diluting the blood sugar level. Just as in hypoglycemia, you have increased urge for having the sugary products. Here you will have increased thirst. In the healing phase, that is during the first part of the healing phase in PCLA, the glucose level decreases to a normal level. And again, in the epileptoid crisis, when the conflict active symptoms are reactivated, the blood sugar rises temporarily. So there will be acute hyperglycemia, which we call as a hyperglycemic shock, and it can induce in a diabetic coma. And then again, it will come back to normal. The sugar level will come back to normal. Sometimes it may also show normal range, showing the symptoms of hypoglycemia. With lasting conflict activity, whenever there is again hanging healing, when the conflict is relapsing, then it becomes an insulin-dependent diabetes and is characterized as type 1 diabetes, also referred to as juvenile diabetes, since it mostly occurs predominantly in children and adolescents. In this case, insulin therapies and dietary measures are vital until the conflict has been reduced. So according to the knowledge of GNM, namely hypoglycemia and diabetes are two conditions of the same biological program. So we learn to understand that so-called diabetes, type 2 diabetes, as we have seen now, that we had hypoglycemia first because of the alpha cell activity, conflict activity, and then the type 2 diabetes. So it is the type 2 diabetes is not caused, but rather preceded by hypoglycemia. So we have earlier seen the complications of diabetes, like the retinopathy, the affection of the heart muscles and all. So in this complication, you have two biological programs which run simultaneously. Say, for example, here in this retinopathy, you have the resistance conflict or the fear disgust of the diabetes and a fear that cannot be shaken off of the retina. Similarly, in cardiovascular system, you have the conflicts of diabetes and overwhelming conflict of the heart muscles. Here in kidney also you have the resistance and the fear disgust conflict of diabetes and feeling like fish out of water, refugee conflict, abandonment conflict of the kidney related issues. Diabetic foot ulcer is again severe separation conflict of the skin, and you have the fear disgust or the resistance conflict. Similarly, with peripheral neuropathy, you are like in the bone related periosteum is wanting to kick somebody away. Okay. Now let us see a short case. So this is a person with diabetes since 15 years with his BSL 477.7. Urine sugar was present. HbA1c was 9.5. And other complaints were sleep apnea, cramps in the calves, left shoulder pain since 2 months. So what was his story? He got married early against the wish of his family and got resistance there. They did not accept the marriage, used to trouble him in their life, but he was helpless, couldn't speak due to reverence, had financial stresses as the family did not support, took all the responsibilities, but always expected support from them. At work, very industrious and responsible, will help everyone but get offended when his decisions are not considered. He gets irritated but doesn't speak up. His main concern was his struggle, responsibilities, and performance. So when he was asked, in what all things do you get stressed? His answer was, I opt for learning things and taking up responsibilities, but I get anxious and nervous and ultimately become unable to do my task in office. And this is a time when I feel I should have had family to support me and guide me. I would have done better. So we gave him strontium carb 200, 3 doses, and things considered were delusion neglected. He or she is confidence, want of self-confidence, support, desire, and need for guidance. This was his main gist of thing. And these are his, of course, this is when he came to us before treatment. HbA1c was 9.5 with 477 and plus urine sugar. Then in the next month, we did not stop his allopathy immediately, but the HbA1c had come down to 6.8 and his random blood sugar was 88 because we had also advised him diet and an energetic and a very agile lifestyle, which included his diet, his exercise, his sleep pattern, because we in diabetic patient especially, we need to correct all these things, you know. And then in the month of November, we completely stopped his allopathic treatment and his HbA1c was 6.7, random blood sugar 153. And this is his last report, which we got. Again, HbA1c 6.9 and 102.3. So this is all. So from all this GNM knowledge, see, whenever the patient comes to you, when you take the conflict, it is very important that we discuss it with patient. We make the patient aware of the things in his life which against like which are resisting him, and where he is spending too much of energy. It could be thoughts, it could be a physical performance, it could be performance at home or in his workplace, or if it is a fear disgust, then you have to identify the cause and talk to the patient, so that every time in his life when such things come in front of him, or when he has to go through this, he is aware of the situation, he is mindful of the situation, and he will react in a better way. And he will he will react in a way which will not harm, or which will not uh, affect the organs, the pancreas, and his sugar will not shoot up. That is all. Okay, there is this follow-up where his sugar levels were reduced, generally feeling better, improved, and his sleep pattern and his lifestyle had become healthy. So he was feeling much fresh, lighter, and rest of his life was in a peaceful way. This is the explanation of strontium. We will not go into this. Thank you so much.